Are these vaginal smelly discharges common? I would say that there is a normal kind of a flora or the bacteria which are called good vaginal bacteria. They tend to have this, just like your sweat or your tears, there is a normal amount of discharge from the vagina. The nature induces these discharges because just like your mouth feels dry and then you can't even verbalize your thoughts properly and impeding your speech, the same way if there is a dry vagina, it carries a lot of problems with it. So normal amount of moisturizing the vaginal lining and the normal kind of discharge which does not typically carry any odor is generally an accepted, a normal thing that happens. But if there is smell which you yourself are feeling awkward with, so you need to spell this out to the doctor concerned. Hello everyone, this is Dr. Hema Divakar. Something is bothering you consistently since the last few weeks. You're not able to express it either to your partner or to your friends or even to your doctor because it's an odd thing that is happening. You're recognizing that you have a peculiar discharge from your vagina with a very fishy odor or something that you yourself are uncomfortable with. Are these vaginal smelly discharges common? I would say that there is a normal kind of a flora or the bacteria which are called good vaginal bacteria. They tend to have this, just like your sweat or your tears, there is a normal amount of discharge from the vagina. The nature induces these discharges because just like your mouth feels dry and then you can't even verbalize your thoughts properly and impeding your speech, the same way if there is a dry vagina, it carries a lot of problems with it. So normal amount of moisturizing the vaginal lining and the normal kind of discharge which does not typically carry any odor is generally an accepted, a normal thing that happens. But if there is smell which you yourself are feeling awkward with, most often it may not be noticed outside of you. You may be feeling conscious about it because you can recognize that this is not normal, this is not what you had before, this is something peculiar. But as I said, you're a little hesitant to express this to anybody. But most often, be aware that the others around you may not recognize it. So you need to spell this out to the doctor concerned. There are some women who have this peculiar odor which is not normal for a very long time. They've kind of in their mind also got used to it, so they don't even mention. But when they come to us for any other kind of a problem, and when we do an internal check, that is per vaginal examination or per speculum examination as we call it, then we notice that odor and bring to her notice that this is something which is not normal. So it can happen the other way around, that the doctor notices that there is something unusual or abnormal. Why do these odors come which are not normal? The moisturization, the normal secretions with the normal flora is a totally different scenario altogether. But when it is abnormal, just like your teeth get infected and your mouth starts smelling, the same way the vaginal area gets infected, either with virus or with bacteria or with yeast or fungus, then there is a lot of discharge which is peculiar, and it also carries a peculiar odor with it. How do you avoid this? One is your general health should be good, your lifestyle should be good, and your nutrition, which is very, very important, and checking your hemoglobin and taking care of your anemia, making sure that you're well hydrated, having good proteins, you have the capacity to fight all of these infections which can come and go. That is one part of it. The second is the hygiene factor, which I said. During your menstrual cycles, need to change the sanitary pads or the tampons at frequent intervals is a must. many have switched over to the menstrual cups, which is definitely more hygienic than the pads or the tampons that you would use, and it's environmental friendly as well. So we would encourage you to use the menstrual cups for sure. And the underclothings that you wear, sometimes you're traveling or you don't have the access to wash them and change them on a daily basis, but you have to ensure that you will do this for the purpose of hygiene and for the purpose of all the other mess that it can bring with it. So these are simple things which are unsaid but need to be followed as a daily routine. And what does beyond the smell these infections bring to you? There can be redness, there can be rashes, there can be irritation, there can be itching, and there could be a host of other issues. When we see that local part, it could be swollen and it could have tiny ulcers, etc., which needs specific treatment beyond taking care of your hygiene to avoid these issues. So when you seek help, we may even take a vaginal swab, and just like how you have a urine infection, you send a urine sample for urine culture. The swabs may also be sent for cultures to specifically find out what treatment we should give. Otherwise, generally, it is ointments or topical applications which will help you get rid of the local problems. The vaginal washes to maintain what we call the pH. It should be in the natural environment, which will not encourage the growth of all these infective organisms, and it could be oral medication as well. One stat dose of antifungal or a short course of antibiotics as the situation would demand. So there could be a nuisance, a daily nuisance of this problem, but there are simple solutions. But we would think as medical healthcare providers that the solution lies more in your hands than ours, because once again, paying attention to your own daily hygiene but not overdoing it. Overdouching, keeping the area very much moist and keeping on unnecessarily using panty liners, etc., can irritate and enhance the possibility of these infections. So anything in extremes is bad. Pay attention to the hygiene and cleanliness. Pay attention to all the little facts that were detailed in this video. But when you do get into problem and you think it is an issue, instead of being anxious about it or hiding it or being psychologically upset about it, please do mention and seek medical care. It is simple and safe to take these treatments. Very occasionally, repeated infections also happen, but as I said, if you have a strong immune system, you can fight out just about anything that will affect you. So stay ahead of times, stay frank and healthy with detailed discussion with your healthcare providers and specialists like us.